Hello, good morning. Yes, thank you very much for the honor. Um, I'd like to welcome everybody to today's session. Yeah, I'm actually very familiar with the walls of this university, so in my right, I can still welcome everybody here. I'm not a stranger. All right, so so we're talking about AI applications in healthcare or machine learning applications in healthcare. I am going to actually focus on the data challenge. All right. That has been probably the most talked about lately in machine learning, generally, all right, not only in healthcare. All right. And I'm going to have a discussion with everybody here. When it comes to applying machine learning in healthcare, specifically for the context of our African region. All right. So that when we come to Ghana, we are also, this will make it easier for us to have this conversation. All right. So why now? Why is it important for us to start having this conversation? All right. Why machine learning? Why are we having this data science summit? All right. And I would say what? One report or a leader's report by PwC says that what? AI is estimated to contribute over what? $15.7 trillion to the world economy. And the greatest impact would be in healthcare. All right. So with their survey, as far back as 2014, there were about 663 or over 600 million people that have started relying on AI healthcare. All right. And by 2021, we've had over 6 billion people that some way, directly or indirectly, are affected by healthcare applications in AI. All right. And what is it that is fueling this trend or these trends in AI in healthcare? What do we have that is fueling this? Value change, value challenge. All right. So there's this demand for long-term healthcare or long-term solutions to healthcare applications or in several populations, whilst at the same time you have limited resources. When you go to hospital-based healthcare, you'd realize that most of the time, most of the resources or facilities that are available are specifically meant for serious health episodes, all right? That requires a specific number of days. But these hospitals are not ready to take in large number of people for this particular purpose, all right? Another one, there's this explosion in the amount of digital healthcare across the world, all right? And health data, so many ways of acquiring health data. For example, when you look at skin specialists, they would be reading over 10,000 articles or 10,000 dermatology articles. If you are somebody that is into medical imaging, you also read, almost every day there are new publications by researchers and people in industry as well. This is based on maybe their experiences or whatever they're doing in research. All right. And by the year 2013, it was estimated that health-related data had reached over 4 million zettabytes. All right, we are looking at about 4 trillion gigabytes of what? Health data. Today, we have actually gone beyond yottabytes. All right, so we are looking at 10 to the power of what? 24 in terms of what? Gigabytes of health data. All right, so that is why it has become important that we start having this conversation. All right, then information technology. Today, there are so many people that are building different forms of systems that help us in healthcare. All right, previously, maybe a decade ago, healthcare solutions focused more on what? The historic and evidence-based care. All right. Today, we are focusing a lot more on real-time outcome-based care. Maybe in the next decade, what we're actually now looking for is what? Solutions that come by way of what? Robotics, AI, machine learning, what have you. So, and then another one is what? The democratization of what? Health data. What are we talking about here? There are so many people that use iOS and Android devices, right? So there's so many ways that you can have access to even produce or collect your own what? Healthcare data. All right. So there's that form of what? Democracy in having access to these. And that actually helps people to what? Proactively manage their healthcare and wellness by themselves. All right. These days, you do not always need a doctor in order to probably see what is wrong with your system or read maybe your pulses, try to see whether your heartbeat is at a normal rate, your blood pressure is at a normal rate or not. These are some of the things that these applications are helping us do. All right. And the willingness of the general public to participate in their own wellness. All right. Today, you can just go onto Google. You're not feeling comfortable with you feel unhealthy or you feel that you're not well, you can just get onto Google, find there are so many ways of finding solutions to what might be your problem, or even having some idea of what might be your problem before you even try to find solutions to it. All right. And there's so many ways that AI is applied in healthcare. All right. I am going to list a few, but if anybody can give me an idea, I'm sure definitely, because everybody here is a data scientist and has done some work. You can give us some use cases of ML in healthcare. Any use case? Let me get about 3 from the audience. Just 3. I know there are a lot of them, but I just need 3 from the audience. Yes.
I know that there's the bed to patient ratio. That's what it's called. Bed to patient. Yes, checking the number of beds available or that will be available for patients.
Okay.
Kind of predicting that as well.
Yes. So closing the gap between the healthcare providers and patients. Okay, we have a second one.
Thank you very much. My name is Juliet. I'm actually a nurse. For AI, I think we have patient monitoring. So instead of patients coming to the hospitals, we have a way of getting them to give us their blood pressures and all that, and then we consult them virtually. During COVID time, that is what we normally did. But I know there are others, especially in the intensive care unit, where we use the remote way of monitoring. Instead of putting the wires to the person, it is transmitted onto the board so that you can actually read. Thank you.
All right, thank you. Thank you very much. Do we have a third one? A last one? Okay.
Okay, so mine is about the introduction of the district health management system that the deems to collect the data to eliminate the folder systems that are various hospitals. Thank you.
Okay. Okay. Thank you very much. Okay, I actually didn't know about that. So there are districts. There's an establishment of a district. Okay, that is actually a very great attempt to solve one of the most difficult problems we have in AI, right? Data collection. Thank you very much. All right, so many ways AI can be applied. Now, from the examples that everybody has given me, I think I can actually skip the ones that I have here. All right. In keeping well, yes, people are using different forms of what? Internet of what? Medical things to provide solutions to their problems so that at least you will not so often need to be visiting the doctor whenever you are having maybe very minor health issues, right? Diagnosis, all right? Some of the big companies that we have in this world that are focusing on research in diagnosis, all right? Some of the biggest ones are IBM's Watson and Google's DeepMind. We also have, in terms of treatment, all right, somebody has come to the hospital, they've been diagnosed of an ailment, and the treatment process, data management, and all that. Then we also have, especially in research. Now, according to the California Biomedical Research Association, it can actually take an average of what, 12 years for a drug to travel from the research lab to the patient. Now, only 5 in 5,000 of the drugs that begin preclinical testing ever make it to human testing. Now, out of these 5, probably just 1, all right, will be approved for human testing at the end. And for one drug, it will cost over what, $350 million to develop a new drug from research lab to the patient. All right. And today, a lot of companies are what, leveraging AI to make sure that they cut down the time and the cost that is involved in this. All right. So that we have what, rapid solutions to developing these drugs. In decision making as well, maybe based on some predictive analysis by some model that you've built. All right. Maybe it's predicting that due to these few symptoms that we have, this person is likely to what? Develop some form of a sickness or a disease. So it helps you what? In decision making, you decide exactly what to do. And there are a lot of use cases that we have in the world today. All right. Companies like Nuance provide different ways of collecting what documents and different forms of documentation and reporting for different forms of health issues. We also have in medical diagnosis, different ways of performing biomedical imaging, all right, in order to diagnose. Maybe for this image here, this is an application for what? Segmenting what? Brain tumors, all right? This is actually an image from a paper that I wrote about 2 years ago, finding different ways. So today, maybe the most difficult thing that we have is training our AI models on devices that have what? Low computational requirements, all right? So if you say that you're using large data, then you start talking about using a GPU or a machine that is what enabled with a GPU. So what happens to those of us who do not really have a machine or cannot afford machines with GPUs, and we want to still train our models on maybe our mobile phone, for instance? How do we do that? So maybe you take, who is familiar with the UNet architecture? Very popular for medical, for segmentation in healthcare. All right. You take a unit architecture, it is quite a large model and has a lot of parameters. Now you're taking some large data set and running through that. But by the time it reaches the fifth epoch, you get an out of memory error. All right. So how do you avoid that? All right. So what we attempted to do was to reduce the unit model by about 8 times and make it faster, so that the computational requirements that you need would be less, and that you can also be able to train that on what? Devices that do not necessarily need GPUs or CPUs that have very high requirements. All right. Then there are so many devices, wearable devices as well that are like the Apple's iWatch, right? Able to monitor health of an individual, collect data, reduce the risk of a heart attack. All right. So now, I talked about the data challenge right from the beginning. I was just giving an intro to how AI applications or how AI can be applied into what healthcare. So let's talk more about what the challenge is today. All right. And we've said that what the bloodline for machine learning, why it has become very important, the growth. Okay, we've said that there's explosion in health data, right? It's not just health data, but since we're focusing on health, there's this explosion in health data. We have it everywhere, all right? And over 80% of this health data is what unstructured, okay? And we need that. We need to be able to find better ways of collecting this data, pre-processing this data, so that it helps in what? Model performance. Nobody has a problem these days when it comes to developing some algorithm to solve a problem, right? You want to do some predictive analysis, you want to do some segmentation, you want to perform different forms of diagnosis. There are so many different forms of architectures that you can use for this, right? So it's not a problem, but if you keep having your model performance not being good enough for you to say that, okay, I've built a model that can do this, then it becomes a problem. We are focusing a lot more on what? Data-driven AI, right? Than model-driven AI, all right? There's this researcher, Andrew Ng. I'm sure everybody has learned something from that man. My first machine learning course online was Andrew Ng's machine learning course in Octave. All right. He has been championing, or he's been encouraging or pushing for data-driven AI. So when you read most of his online articles and blogs, if you follow The Batch, that's a very popular blog that he writes a lot of articles on. And they will tell you that let's focus on the data, right? How do we get high quality data? And that's him. Anyway, so he says that it's what? You need a lot of time to source and prepare high quality ingredients before they cook a meal, all right? After the cooking, we all know how to cook now. If you're told, well, cooking as in building your own ML model and training it, right? But the ingredients, all right, is our data. And it is very important that we spend a lot of time on that. And so there was this research by Skills Gist, AI Readiness Report. And it talks, in their survey, they talk about the top challenges, right, that we have in training data. And you realize that the first two have to do with what? Data quality and data collection. You have data quality being about 33% and data collection being about 31%. It tells you how difficult it is, or that the process of what data collection and data quality. All right. They also talk about the volume. All right. How much data do we have that is actually structured? Okay. From PwC's leaders report, over 80% of data is what? Actually unstructured. All right. What are some of the other problems when it comes to the quality of data? There's too much noise in data. When I talk about noise, not that we have somebody playing loud music and disturbing our data. All right. We have unwanted. Okay. When I say noise, what do I mean? Anybody to help us? When you have noise in data, yes, you have a gentleman here.
the like empty or now data. Empty. Like now, nothing is in there.
Empty. Okay. Oh, so we have a lot of missing values in our data when we are okay. All right. You know, I am actually very vision or computer vision biased. So when you start talking, I'm not looking at tabular data. I'm actually trying to imagine images and videos in my data. All right. So then data bias. Okay. Representation. Are you collecting data from just one area and then saying that it is for everybody or it represents everybody? All right. Some of the very first face detection algorithms that came out, you realize that people like us, people that have my skin color, will never be detected in that particular algorithm. So they had to start with adding more to the data and varying the data. Okay, let's bring a lot more Africans into the data when we are training our model. All right. So data bias is also what very, very important. Then this is a very important one that I want us to talk about. There's this AI readiness index that is done every year. It's been done since 2017. And almost every year I've read it to see whether there's any change in, especially for our continent here. All right. And what is the 2021 AI readiness index? What it does is that it ranks different countries based on how ready they are for AI. All right. And last year, 2021, is the most recent one. And it ranked over 160 countries in total. Okay. And what it does is it's based on 3 different forms of pillars. Government, how is the government involved? Data and infrastructure, all the processes that come into data collection, getting ready for AI. Do we have access to it? Do we even have the necessary infrastructure for it? All right. Then we also have the technology sector. Right? How robust is this form of technology that we are building to help us in developing AI? And amongst these 3 pillars, there are about 42 indicators that are taken from what? 10 dimensions. And you have so many different dimensions: representativeness, vision, government and ethics, digital capacity, adaptability, and all that. So let me give you a brief summary of what 2021's AI Readiness Index gives us. What is the question? How ready is a given government to implement AI in the delivery of what? Public services to citizens. All right. We said we are moving towards, especially in healthcare, we are moving towards what? Product-based to service-based. All right. And if you're moving to service-based, then AI, machine learning should help us a lot in providing certain services. All right. The most important, since we are talking about the data challenge, among the 3 pillars, the most important for us is what? Data and infrastructure. Okay. And we're saying that infrastructure contains what? High quality data. That is the availability of data. That contains what? Whether we are avoiding bias, we are collecting proper or high quality data. All right, representativeness, okay? So it means that we have the necessary tools to develop that particular pillar, that is data and what? Infrastructure. And there's a summary. East Asian countries, that is China, Korea, Japan, they make up a quarter of the top 20, all right? They've invested heavily into AI, a lot. And other high scoring groups involve what? The Nordic countries. You're going to Finland, Sweden, Norway, and all that. Let's come to our own region. All right. The average score of the 2 lowest ranked regions, all right? And the two lowest ranked regions are what? Sub-Saharan Africa and then South Asia. When you talk about Sub-Saharan Africa, then that's us. When you're talking about South Asia, maybe you're talking about Laos, the other smaller Asian countries that are down there. And you would see that Africa, Sub-Saharan Africa, ever since 2017, has been the lowest ranked. Okay, and let's look at how we are ranked, especially when it comes to all the African countries that were represented. There were 41 countries that were represented in the 2021 AI Readiness Index. All right, and you would see that the highest was what? Mauritius. This is over 100%, and Mauritius is what? 52.71%. Okay, in terms of what? Its readiness in AI. All right, and that is the highest we have in Africa. So that means that the rest of us are even below 50%. And this, let's see the one that is highlighted. Of particular note is the average score for the data and infrastructure pillar. Have I gone far? Is what? The data and infrastructure pillar. 39.36 out of 100 is what we have. That means that now all the other regions have at least about 50. Okay. For Africa, we are at 39.36%. Okay. So in terms of our readiness or under data and infrastructure pillar, we score the lowest. And 39.36% in school, it's a fail. All right. We couldn't even reach 40%, just about what? 0.64% for us to get there. All right. And Mauritius comes with a score of 52.71 from what we saw over there. Now, when you look at how this is ranked, so this is the highest we have. And for data and infrastructure, we're looking at what? Representativeness. We're looking at availability, and we're looking at what? Infrastructure, the average of it. All right. So that is how far we've come. But there are a few things that some of these governments have started doing. All right. So we can't all say that, we can't just say that everything is that bad for us. At least we are also trying to do something. All right. So they say governance is very important. If you look at the three pillars, data and infrastructure, governance is also very important, right? And the question is, how ready is your government to implement what? AI. And there are a few countries that are doing something. Mauritius, they've developed an official national strategy for AI. Actually, that is the only country in Africa that has done that so far in 2022. And South Africa is yet to launch, but they're also working on something. Then Kenya has also developed a task force. They've selected 11 experts to also help in championing development of AI. Then Ethiopia is also working on that. Botswana, Rwanda, Ghana, they're all trying to do something about it. All right, so what about us? The data science community, what are we trying to also do in order to support maybe our governments in what they are in, or in trying to reach that particular level of maybe even developing an AI strategy or a national AI strategy? All right, some facts. Now, this map, what we are seeing here is malaria, the spread of malaria and the deaths that malaria has caused across the entire universe, or the entire world, sorry. In sub-Saharan Africa, you can see that that is where we have the highest forms of transmission, okay? There are a few somewhere in Asia. This is around India, then in South America as well. But you realize that our biggest problem is here, sub-Saharan Africa. All right. And it's estimated in 2020 that over 627,000 people died of malaria. All right. And in 2020, malaria caused an estimated 241 million clinical episodes. And an estimated 95% of the deaths in 2020 were from what? The African region. Okay. Why am I even talking about this? If you do a quick Google search on malaria smear, what are they called? Malaria smear images data set. Okay. You find that there's a data set that was collected by some US research center, or there's one that was collected in India. That over 95% of us are dying. We are not really building that form of infrastructure that will help us collect data. Okay. So as a data science community, how can we get there? How do we start building our own data sets, make it publicly available, allow people to contribute, and so that we can actually grow something that we can call our own that we're using? When you look at COVID-19, okay, as for COVID, we'll all brag that as for Africa, many people did not die, so we are good, we are okay. But then, you see, when people started dying, it didn't take more than 3 months to see a research paper that actually collected chest scans for COVID-19 prediction. How quickly did they do that? Or how did they get to collecting chest x-ray scans to do that? Now, we that were not would say that, okay, more people died in Europe, more people died in North America, more people died elsewhere. But weren't we curious enough to also start collecting this to help us determine why we probably aren't dying as fast as the people on the other side of the world? So maybe because it's not affecting us, then we don't care. Even the one that is affecting us and 95% death is coming from us, we still do not care. So why should we be surprised? Well, so for me, what I feel when it comes to providing solutions in data collection, I'm going to mention this one, and I hope that maybe somebody else will also mention another. All right. Digital first solutions. There's this proliferation of so much information on social media for us. All right, there's so much. Can we use WhatsApp? Can you use Telegram? Can we use our wearable devices to collect enough? Some of us have these wearable devices. We're always running, we're always checking our heart rate. You look at your BMI and you know that the limits that you can get to in terms of your heartbeat shouldn't be a certain level, more than a certain level. Very few people actually know that based on your BMI, you can only do much with your heart. Your heart actually has a certain limit, right? So that if you're just following some fitness coach online, and he says that run 10 kilometers at a speed of maybe 15 kilometers per hour. And then you see somebody rigorously doing that and then falling off and passing out, completely blacking out. You do not understand your system, all right? But there's a medical doctor somewhere, or a specialist that can actually help you and let you know that, okay, maybe with your current status, don't do beyond this particular form of training. All right, but we are collecting all that data actually we are not the ones collecting the data. It's those that are developing these wearable devices for us that are collecting the data. How do we start documenting this form of data that we can present, have it historically, so that if you're having a chat with a medical doctor or a specialist, the person can actually tell you that what you're doing is probably good for you or not. All right. WhatsApp, how do we even collect information from WhatsApp? And I'll give you a use case. At Ashesi, they started talking about providing different ways of communicating transactions, different forms of transactions in banks and financial institutions, all right, in the local languages, so that people will have it easier to make certain requests in their own language, all right? So building a database, a data set for their NLP, all that was collected on WhatsApp, right? And so far, they have done that in 4 different languages, several thousands of data that you can use to train your own model. They made it publicly available. Can we also make it that if I have symptoms and I can better express that in my own language, all right, so that they know that, okay, this is exactly what is wrong with me. I can have better diagnosis, all right, or predictive analysis, or what have you. Can we collect that? Can we start, as a data science company, can we start collecting that in different languages so that people would be able to express themselves about how they feel? Then they can get better responses, all right? So for me, everything that we have access to today should be able to help us to collect that data. We do not have to start going through maybe different forms of administrations and, okay, we want your permission, can we get this? And then they start tossing you around. Then probably they don't have that data at all, but they'll keep telling you that, oh, you have to talk to this person. And just say that, okay, we don't have the data. And then maybe we'll start talking about how to start collecting this data to help all of us. We collaborate, all right? I can't say that, okay, I'm into computer vision, I'm into deep learning, and I want to collect medical image data to perform some form without understanding exactly what that particular data is about. We will need to collaborate with people in industry, for instance, those people that understand that particular data that we are collecting in that industry to work with. So for me, that is what it is, digital first solutions. I want to ask among the audience, does anybody have, or do you have an idea how better collect data, how we can start fighting this data challenge that we have? I have digital first solutions, so I want somebody else to give. Okay, we have one person over there.
We had a chance to pitch at Ghana Tech Lab for local startup summit. And then my colleagues and I brought something up, and it was actually about, most of these data can be collected at the rural areas because that's where everything starts. We can't just, start working with those in the urban cities or like urban areas, and then like we can't just start working with them whilst those are there. So we came up with a solution, but unfortunately for us, it wasn't really accepted. So the first thing is, recently the government announced that they want to recruit 5,000 SHS graduates to the various CHIPS compounds. And then per our research, we realized that we have over 4,700 CHIPS compounds in Ghana. So meaning they are going to train these people in data collection, and they are also going to assist the nurses. So what we planned initially was that we introduce an Excel database system for them for like primary taking of data, so that when the patients come in, they will able to take their data on the Excel. You see, one thing happened at the Lands Commission some time ago, the safety of the folders cannot be guaranteed, because after an extensive rainfall, their documents got destroyed by the rainfall. So with Excel or with any other computer database management system, data can be like stored and then it can be uploaded to the cloud. So with the Excel, we use the Excel as maybe a back end, and then we develop a software that will serve as the front end. So we can also, liaise with the maybe MTN or other network service providers, so that even with the least internet connectivity, the nurses or anyone at those health centers can upload the data that they've collected into the database, and then we can make decisions on that. So with that, when analytics come in, you will be able to identify the kind of diseases that affect the various communities, and then you know that this area maybe there is excessive, or this area there is, let's say, malaria over there. So then I'm sending malaria experts to this area. Maybe there is an outbreak of cholera at this place. So you know that since there is cholera here, you are sending cholera experts to this place. So with that, I think we can be able to start and then build something better and then make it big. Yeah.
Oh, we have another person. Okay, thank you very much for that submission. You would realize that even at the when you look at the response, the Readiness AI Index, it also it talked about representative data and data and infrastructure. And what he's talking about, you'd realize that most of the time when you're collecting data, it's actually from the urban region. And then we are using that to represent most of the rural areas. And I think that that is a very interesting solution that we can also have for our data challenge in healthcare. Okay, we have one more submission from.
Okay, so apart from what he's saying, the healthcare data is really unstructured. We have a lot of things that are written instead of putting them into simple things that people can count. So the first thing we have to do is to break it down into identifiable metrics so that we are able to count it, so that the word will be across everybody. If I say assessment, it should be across everybody's language so that we understand. One way we tried to do it was to get a WhatsApp page. So in my organization, we use Microsoft Teams a lot, but we realized there were people who did not have access to that because you need license. So the WhatsApp page, even the cleaners have phones that are Android. And so they could give you maybe the number of disinfectants we have in a day. So that is also a way we use to collect data in the organization. So now we collect it to a WhatsApp page. There's one centralized person who puts it on the Microsoft team page for us, and then we use. Another thing is that in the healthcare, we have two different data. We have data for patients, and then we have data for administrative or healthcare purposes. If you go into data for patients, the patient's data, you have to create a platform for them. So we have the electronic medical record system, which is quite different from the DIMS. The DIMS is collecting data that we have worked for, but the electronic medical system collects data from patients. Like when you come to hospital, you come and report all the things that are associated to you. Where we store that data is different from the work that we do. So if we could differentiate that and get people to be able to manage those data for us, I'm sure we'll get cleaner and safer data. Thank you.
Okay, thank you very much. So to summarize it all, proper curation and annotation of data so that data is actually put or created in context for better understanding. Okay, so Do you have any other one? Oh, okay, we have one. Okay, let's make that the last one. Then I'm sure my time is up. If I'm giving extra time, maybe we'll keep talking.
I would think the best way to get data, enough data, is to make a policy to eradicate collection of data. So we can make maybe every institution shouldn't collect data by paper, or to make it accessible on a device. So by that, it will be easy to annotate or to do whatever I want to do with that. So
yes.
instead of maybe copying from paper to a device to be.
Yes, okay. Slowly transitioning from paper collection, just physical documents, to more digital based data. Someone has that. Okay.
Yes, so this one just builds on what the guy said about the district health management systems, that we could, so where I take medical services, they barely do any paperwork. So it will probably be very costly for the rural areas in the short term. But I believe with slow development and with time, it can be at least rolled out in the urban areas, so that as the data is centralized, the data can be made available to maybe a data division of the Ghana Health Service, and then they can begin with something, and then maybe some. You see, Google Maps has this offline part for the areas you frequently visit. So maybe some kind of that functionality for the rural areas, so that at least if they don't have internet access, they can make the entries for the time being, and then maybe take it to a central area, maybe district capital regional area, to be integrated into the national data set, so that at least there will be regular updates or periodic updates of the data, and then something can be done, something can be started. Yeah.
Yes. Thank you. So it's not every rural area that you would find that probably has access to internet, or even some of these tools that we can use to collect data. So how to make it easier to collect, so that whenever they have access to it, they can also contribute to that data collection. Okay. Thank you very much, everyone, for your submissions. I just want to end this by mentioning a few startups. I quickly Googled to see whether I could even find a lot across the continent. There are very few that I know about. So I wanted to see how many I could also put together. And you have one startup from Nigeria that uses AI to help individuals send a list of their symptoms via text, audio, and photographs to diagnose their medical condition. There is also another one that uses, that is known as Chill AI, that uses machine learning to bring reality to telehealth services to Africa. There is also a Chill AI. Which country was that? I think Kenya. I don't remember. And then you have Diagnosify. That is actually a startup in Ghana that is used to diagnose skin diseases. I know they won a competition a couple of years ago. That is how they came into limelight. Then we also have Delaney Tech. They provide different solutions for diagnosis and screening. All right. We also have urology that is used in solving problems of the shortage of radiologists. We also have Freeberg Medical. They also use that to so in the value chain, they actually use that in reducing risks, okay, in their supply chain of providing hard medical supplies or medical tools. Then you have Dr. Kadex. This guy actually presented at the NVIDIA GTC conference last year or last 2 years? I remember joining that particular conference. Then Mino Health AI Labs that produce use cloud-based systems to provide AI solutions in healthcare. All right. And we have Afia Record that also, this is also in Kenya. And they capture, store, real-time access and mobility of patients with health data. Then you have Dawa. That is, Dawa, I think is in Zambia, if I remember. And based web mobile platform, which is aimed at facilitating remote healthcare, specifically for pregnant women and early mothers. All right. So that does it for me. Thank you very much.